Hey everyone, welcome back to another episode of the Brawn Body Podcast brought to you by Isophit. Today I'm welcoming Hannah Sadowsky, Doctor of Physical Therapy, onto the podcast. Hannah grew up as a gymnast and then coached gymnastics and now is a physical therapist who works primarily with gymnasts. So Hannah and I discuss the unique considerations and needs of gymnasts, and we talk about a variety of assessment, rehab, and return to sport test details. There's a lot of great insight and great information in this podcast for you. For more, I highly recommend you check out Hannah and everything that the team at Old Bull Athletics down in Florida is doing. They're really doing an amazing job doing so many amazing things down there. I highly recommend you check them out. And I also highly recommend you check out Isophit, our official sponsor for season 5. You can read more below. Hannah, welcome to the podcast. I'm super excited to work with you today. Thanks for being here.
Hey, I'm super happy that we could finally get this going, and I can't wait for all that we have to talk about on the gymnastics topic. It's my favorite thing to talk about, so let's get going.
For sure, for sure. You mentioned that gymnastics is your favorite thing. For people who might not know you that well, or maybe they haven't seen all the incredible things that you're constantly doing over on like Instagram and that sort of thing, would you mind filling them in a little bit about who you are and all the amazing things that you do?
Sure. So my name is Hannah. I am located currently down in Miami, Florida, and I'm a physical therapist. I have a pretty extensive background dating back to the age of 6. In the field of gymnastics. So I myself was a gymnast growing up. So that's kind of where my love for the sport began. And I went on and did gymnastics up to about 17 years old, just before going off to college. At that point, I kind of switched gears around the age of like 15 to 17. I worked as a coach in my hometown gym. Loved that so much, kept coaching through college. So undergrad, those 4 years I was coaching. And I did that in Orlando, Florida. And then into grad school to become a physical therapist, I continued the coaching life there. So about 13 or so years in the coaching realm of the sport. And now, as I'm full blown into my career as a physical therapist, I have a pretty large caseload in the gymnastics, cheerleading, dance realm. So I really enjoy tying all those pieces together from the athlete perspective, coach perspective, and most certainly as a physical therapist perspective.
Yeah, definitely. That's awesome. And as you mentioned, that kind of, trio of sports, I'll call it gymnastics, cheerleading, and dance is one kind of cluster that I feel like a lot of PTs don't know a lot about. It's something that, a lot of PTs don't get to watch on TV like we watch, Sunday night football or, baseball almost every night of the year. So I think this is an area that people can really learn a lot more about, myself included. I've had the pleasure of rehabbing some gymnasts in the past, and I certainly learned a lot from them about the sport and how there's different events, and each one scored a little bit differently, and they're looking for different things in each. For people who might not be familiar with the 4 main types of events in gymnastics, and maybe there's more out there other than the floor, beam, bar, and vault, would you mind filling them in a little bit about what each of them are and what kind of things go into them from a needs analysis standpoint?
Yeah, definitely. So stay tuned because 2024 Olympics are coming up. So you'll get to see tons and tons of really cool gymnastics, which is like my favorite thing to watch. But going into the event, so just depending men's versus women's gymnastics, they compete in a different amount and different actual events. So I'll run through the women's events. There is 4. Order wise, you can say them in any order, but a typical like competition style, you're going to hear vault, bars, beam, and floor. And just briefly running through them needs analysis wise. Vault, you're going to see a sprint. So short distance, but very fast sprint. Jump on a springboard and do some sort of flip over what we call a table. So you're running horizontally, jumping vertically, and then performing something bizarre over a table. Most skills, when you're dismounting these events, you want to stick the landing. So kind of keeping that in mind as we go into bars next. Bars is going to be the uneven bars for women. And I clarify that just because men have P bars and high bar. The uneven bars for the women, and that's going to be a low bar and a high bar, we call it. And it's one apparatus. You have the low bar, jumping to the high bar. Usually you're going to see a lot of skills performed between the two. So letting go and flying back down to the low bar, or standing on the low bar, jumping up to the high bar, and then performing skills that are either circling around the bar on your arms, turning on the bars, or flipping off to stick that landing. We'll go beam next. Beam is going to be 4 inches wide. So all the crazy things you might see done on the floor, but on the beam. So doing that on something that's 4 inches wide. Beams are standard. They don't get any wider, unfortunately. You're asked to do all your skills on that. And it's really similar to floor in the sense of the skills you do. So a lot of flips, a lot of jumps, a lot of turns, and then that dismount off. And then we go into floor, which is a spring floor. So a little bit different than this typical floor you just walk on, or even you see for other sporting events. You're going to have a layer of springs with wood on top, and then a small piece of carpeting over that. And I clarify that because it's pretty important when you're rehabbing these things, understanding those different style of surfaces so that you can progress the rehab appropriately. So all in all, on the floor, you're seeing a lot of flips, a lot of jumps, turns, leaps, and dance.
Gotcha. So it sounds like a lot of plyometric activity, but you also mentioned the dance piece. There's an element of choreography and an element of endurance that comes with that. And certainly from some of the athletes I've seen, I've been amazed at the balance that these athletes have to go from one position to the next almost seamlessly, and almost make it look more like an artistic element than a sport element, for lack of a better way to put it.
Yeah, exactly. And the sport is actually termed artistic gymnastics, of what I just described, those 4 events. So it's exactly right. These skills are meant to be performed as if they were effortless, although they are not. So, and that's where the scoring system comes into play. So it's one thing to be able to do these difficult plyometric skills, standing moves, different types of like swinging skills, but it's another thing to do them without any technical errors, which is really what makes up the sport of gymnastics. Because if you do end up going the competitive route, which is what we tend to see in the clinic, these injuries happen at maybe a little bit of a higher level, or girls wanting to get back for competition, then you're really honing in on the technical piece, because that's how their score goes up. That's how they can get it, good enough in one level to be able to progress to the other. So yeah, you need it to look great and feel great in order to get to the next level of skills that are much harder, but then you have to do those that look good and feel great.
Yeah, and before we get into the considerations and events for the men's, I feel like you bring up such a great point with that. Is a lot of physical therapy, at least from what I've seen, and your typical models, they focus on, well, it's pain-free and it was what you were doing before. And they stop there. And they kind of forget that it's a little more than that with a sport like gymnastics. To your point, you're scored on how effortless you make it look. So just because someone can do it and it doesn't hurt, doesn't mean that they're doing it at the level that they need to do it at. So I feel like we really need to find a way to take it a step further to make sure that we get them back to that part of it. Because in a sport like gymnastics, that's the make or break difference for you.
Right. And we hear that being tossed around in the PT world, and it is correct to some extent. And we hear a lot of talk, at least I hear a lot of talk about that word perfect. We're not perfect and things are not going to be perfect. But in the sport of gymnastics, the perfect 10 is what you're striving towards. And so not saying that everything or everyone does need to be perfect, but when we are progressing back from some form of injury, or maybe training them to achieve certain skill level, the skill has to be done correctly by the book. And there's a book of how all these skills should be performed. And this is how the judging process is done. And so that is a consideration, because it's one thing, like we said, to do a backflip, but if it's not being performed technically correct or by the book or how the scoring system is wanting to see it, then that gymnast might not be scoring as well as they'd like. And that could hinder them down the road.
Yeah, it's almost the polar opposite of physical therapy, right? Nothing in PT is ever by the book. And in gymnastics, it sounds like everything is by the book.
Yeah, and they have done a really good job, like physics wise. These skills are coached and taught, truly based in science. There's a reason why your head should be in a certain position, or your body should be in a certain position. Your arms should be overhead, because from years and years and years of training and coaching and scientific studies, this is how you produce the most power, the most force, the easiest rotation. And so, yes, you are really trying to drill these different movement patterns and body positions so that the athlete has the best success.
Now, on the men's side, you said there's a few differences between the men's and the women's gymnastics there. I think the men's add in ring events too. Is that correct?
Yes. So the men have the vault, which is the same. They have the floor, which is the same. And then they start branching out. They have high bar, which is a single metal bar. They have P bars, which is 2 bars that are level side by side. They have pommel horse, which is that thing you see the legs flare around a lot and they stomp their hands.
I always wondered what that was called.
Yeah, the pommel horse. They have rings. And what did we miss? We have vault, floor, high bar, P bars, pommel horse, and rings. Nope, we got them all.
Awesome. And for the rings especially, I've noticed that seems to be a lot of very advanced, like muscle up type maneuvers, iron cross. Like that's one that I've always been very impressed by myself, because I'm not very good on those things. My shoulders don't hold up to them, Hannah.
So yeah, it's a huge demand on the shoulders. Whenever I'm rehabbing someone back, there's so many levels of shoulder testing that I actually incorporate, which we'll probably get into in just a bit, but it is majority pulling and stability. So you can imagine whatever you do on the floor that's hard, putting it on rings that are unstable and making that look effortless. So a lot of dip positions, a lot of pull-ups, like you mentioned, a lot of just like front supports, which is getting up there and staying up there. I don't know if you have tried the rings recently, but just jumping up and trying to hold yourself, the arms are like shaking out of control. So being able to control your body in space, which again, we know as proprioception and, different types of like neuromuscular techniques to control our body, times like 1,000, because you're being placed on the rings, you're being scored, you're being asked to move your body in funky positions. So it's a very cool sport to progress in all aspects.
Kind of mentioned about proprioception there, and this is more of a body awareness of the total body. I feel like we talk about that a lot of times in terms of like, the foot and where the lower extremity is, but we don't often think about the full body. Like, what if the hands are the main point of contact with the ground, not the feet? Because in gymnastics, we kind of flip the tables on things like that. How do you go about assessing someone when they come in to see you from a movement standpoint? Like, is there any kind of screening battery that you use or you develop, or how do you kind of go about assessing all these complex gymnastics-based movements in your clinic?
Sure. So where I am down here in Miami, I'm at Old Bull Athletics, and we're fortunate enough to have a setting that is a gym. So in that case, we have the space and we do have the equipment to be able to perform some of these assessments. So typically if someone's coming in and it's more of a general screen, I'm always going to go head to toe and look at shoulder mobility. That's going to be like high on the list, because these athletes need so much overhead motion that we need to see, do they have it? And if they don't, of course, we have to help them get it. Moving down the chain, I'm going to look at how their spine's moving. Because of the demand and the positions the sport requires, we want to look if they're having any limitations and be able to address it. And then coming down the chain, key high on the list is ankle mobility. So they all seem, very obvious, I'd say, coming from the the PT perspective, but you're looking at them just a little bit different. And how I typically go about educating, whether it be the kids or the parents or other PTs, is we have our normative ranges that we learn in school and we have in our textbooks, but these athletes, they need to be above. That's typically what I tell them, because most of their skills are not like the normal. And so that's what I usually say. So when I'm looking at those things, we're going to say, well, here's what we need to get to, but here's what we really need to get to in order for you to be paid free or have these skills come a little more seamless to you and not have to maybe work so hard to perform future skills. If we can tackle maybe these lower hanging fruit things like shoulder mobility, ankle mobility, or spine mobility.
Right. Yeah. I love those kind of general things. And it's interesting you bring those up because I feel like when I end up rehabbing gymnasts, it's almost always a back, a shoulder, or like a ankle knee type thing. At least that's just been my experience thus far. So I love how you picked out those areas right away. And I love how you kind of broke it down in that there's like normal mobility recommendations. And then there's those required for gymnastics. And, gymnastics, as we mentioned, it's artistic in nature and it has to look effortless and seamless. And, maybe you can get someone to a certain position, but it takes a lot of effort for you to get there. And that's not going to fly in a sport like this. So you have to find a way to make the quality of that movement improve to a point where it's effortless and seamless for the person in front of you. And, oh, by the way, that's probably a little further than normal. And I'll take it a step further and say it's not enough just to be able to move there. You also want to be strong and resilient in that position. And that's an area I don't see assessed commonly in the physical therapy world is, we look at gross strength, but how often do we look at the strength differences in certain positions, right? What about, the hip joint at this angle versus that angle of rotation, or, the ankle plantar flexion strength in an extreme dorsiflexion position versus a straight knee position. I think really kind of to a certain extent majoring in the minors and picking apart those little minute details of where deficits can lie for gymnasts can really elevate your rehab game here.
Yeah, absolutely. Those end ranges are pretty crucial, especially as the girls are aging. Most of these athletes are young. They start the sport young and they can progress pretty quickly within the sport. And it's the strength, the level of strength that these athletes have that kind of predicts the future of their progress. Because as you were saying, these demands and these range of motion for the skills is so great. If they don't have that strength to surround that large range of motion, that's when you tend to see more injuries because they progress a little too quick or overuse or just different little aches and pains that really shouldn't arise, but they do because their strength is not up to par with the drastic skills that they're trying to do. So it is really important to kind of keep that in mind, that when they do have to have their legs open 180 degrees for a split leap or a split jump, building the strength up in that range. It's one thing to kick your leg from 0 degrees to 75, but can they build that strength from 75 to 90? Because that's where that front leg has to be. So painting a picture, your chest is upright, you have one leg in front, one leg in back, and it's a perfect horizontal line.
Right.
So most of us cannot even remotely consider getting there. But again, these are the requirements as you get older and progress in the sport that these judges are looking for.
Right, exactly. And you mentioned the point of progressing in the sport, and I don't want to get sidetracked by that too much, but if I remember correctly, there's a lot of different tiers and levels to competing in gymnastics, and there's different names for each one, but I think there's like a level 8, 9, 10, and over time, as you get older, you progress up through the levels. So it certainly makes sense that the sport is progressive and the demands get more challenging as you kind of age and mature in the sport.
Yes, exactly. There's 10 levels in your standard gymnastics progression. The first 5 they call compulsory. These are all very standard routines. You are all performing the same skill, the same routine on each event. By the time you hit level 6, things start to get a little more fun, and you get to have your own routines where your choreography is your own, and you have a selection of skills that just need to meet a certain requirement, but you have options to choose from. So you start, varying, and you can use skills that are more to your advantage or skills that you're better at. And that goes up through level 10, which is where you'll start to see a lot more variety in the sport. As long as you're hitting these certain requirements, you can have more variety.
On the injury standpoint, you had mentioned, or I had mentioned a bit ago, that I've seen a lot of, lower quarter, back and shoulder injuries in gymnasts. Is that typically what you end up seeing at Old Bull as well? Or what type of things do you end up treating in gymnasts?
So the most common is going to be foot and ankle. And the reason behind that, because when you see it enough, you wonder, okay, why is this happening? Is going to be the ground reaction force, the contact. It's the first thing that hits when you're landing these difficult skills is going to be the foot and ankle complex. And so I tend to see that as the most common injury. And it's typically going to stem from overuse versus traumatic. Now, don't get me wrong. There's plenty of traumatic injuries that I do see, but the overuse on the foot and ankle is very, very common. You have a hard landing on every single event. Like I mentioned before, the stick position, when you're vaulting, run, jump, flip, 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 stick. So that, that's going to be a landing from a high height. Then you have bars, you're flipping off of a high bar. It's another landing from a high height. Beam, same thing, that beam's elevated off the floor, landing from a high height. And then floor, you're doing a flip after a flip and then a really high flip to land from a height. And so that's kind of the reasoning behind why the foot and ankle tends to be the most common. And then working up the chain, knee, I see a lot of knee, and back stemming from similarities that I just mentioned from the foot and ankle, those landing patterns, and then a lot of that arching or extension based movement pattern tends to bring on back pain.
I think just from my head, my mind goes to like tendinopathies, bony stress fracture type things, and then like spondies in the lower back.
Yes, those are very common. And I like to bring up the other stuff to not be forgotten too. Just typical like muscle strains are going to be pretty common. And not only is the spine going to hurt from extension patterns, but also like maximally compressed patterns. So bending forward, because you have to remember, not every skill you do is perfect. These athletes tend to practice and fall pretty often. And although the equipment is there for safety, you're still going to have some injury. And so if you're landing a skill short, you're going to see injury from that. And then when you start getting into twisting motions, you're going to see maybe more of those muscle strains, but in a rotational component. So kind of keeping an open mind that maybe not everything is a spondy, and it's really just going to come down to the assessment and making sure that the assessment is done well. So you're not guessing at what might be the issue, and you can actually pinpoint and tackle what's really going on.
Right. Nail down the diagnosis, because, there, to a certain extent, there's certain times you can get away with not having 100% clear picture of what it is and be okay, right? Like if it's, take like patellofemoral pain syndrome, for example, there could be probably any one of 10 different factors contributing to that. If I don't nail down the 1 out of 10, if there even is one of those 10 that's driving the whole thing, I can still probably treat it and be okay. But, when it comes to some of these other areas, like we've talked about, it certainly helps to nail down the area that you're working on. Because if you treat that lower back pain like it's a disc and just go all off into the weeds with McKenzie, that might not actually get it better. So I love your point about that. And I'd imagine it's kind of difficult to impossible to progress someone back to gymnastics if you don't really know what you're treating in the first place.
Yeah, that it can be something that tends to happen, why someone might not get better. I've heard that a lot, where they start to get better and then they kind of taper off and the pain comes back. Or as soon as they go back full force into the sport, the pain comes back. I think it's just important, if you can immerse yourself in the sport as a physical therapist, whether you were a prior gymnast or whether it's your current like niche area, just really learning about what goes on in the gym can really give you a good idea of how to help the athlete and treat them back. Because like I mentioned, those different spinal movements, they're coming at a really high force as well. So you want to recreate some of these movement patterns under the force. And if you're not quite understanding what they're even doing, you're going to miss a big chunk of that return to sport phase.
Right, right. No, you bring up a great point. And on the return to sport side for a second, we talk a lot on the podcast about return to sport for overhead athletes or for, post-op ACL or post-op meniscus, all these various common sporting injuries, but we never really go into it from like, say, a gymnastics standpoint. And I would imagine your return to sport test battery or criteria will look a little bit different than what we normally see in the post-op population. How do you go about assessing whether or not someone is ready to get back to gymnastics?
Yeah, good question. And there's not a ton of research because it is very hard to assess the level of force that's occurring in these skills on different surfaces, during different moves. And so some of the things through my experience have been on top of what is out there. So especially, let's say we're gonna look at the spine or anything lower quarter, really, I'm still gonna go through the hop testing protocols, making sure that they have double leg hops, single leg hops, and keeping it a good comparison, just left to right. But then I'm also gonna look at the movement pattern that they have to get back to. So I'm gonna look at triple extension in an arched position. So fully going back overhead like you're going to do a backflip or a back handspring. I'm going to look at loaded heel raises. So it's one thing to have, and we say like 25 to 30 single leg heel raises is that normative value to be able to, feel good when we're running. So running is about 3 to 4 times body weight every time that we strike the ground. Gymnastics average forces is about 6 to 14. So astronomically higher, meaning let's take those skills and we have to load them. There has to be some external load added to these typical like functional movements in order for me to even consider going back into these skills. The other thing I think that is important in the battery of returning to sport is the basics of the skills. Sometimes it can be scary to say like, yes, you can go back, but you have to remember there's so many skills that you regress and they can do. So it's one thing to do a handstand, but then it's another thing to do a vault, which is running and jumping on your hands. And so that is part of my return, is making sure that the basics that come before the skill that they have to return to is being performed well, with good form and good technique, and without pain, of course.
And that sounds like a everyday kind of thing. It's not like a testing day like we often think about in terms of the ACL. It's a everyday. We know the end goal. We know where we have to get back to. We know where we are on day one if we do a good job of assessing. And then each time we come in, we're either moving the chain forward and progressing or regressing slightly back. And if we're progressing, then we kind of almost build like steps from level 1 to level 50 of where we need to get to be back. And, I'd imagine if your athlete gets all the way to level 48 on that hypothetical scale and they're still doing okay, you're a lot more confident about getting them back to gymnastics than if they're still, stuck on that hypothetical level 12, for example.
Correct. And I like to tell people, think of it just like you do rehab the ACL or the meniscus or anything lower extremity. You're really doing that, but considering the upper extremity as well. And then with that, comes impact on the spine. So before we can run, we need to walk, we need to hop, we need to hop on one leg. It's the exact same for the upper body. Before we can vault, and I'm using vault because you do a really big, fast sprint and then power up, flip onto your arms and flip off. So you need to be able to stand on your hands. Then you need to be able to weight shift on your hands, walk on your hands, jump on your hands. And all with that in mind, you're getting impacts through the spine. So this is all conditioning. This is all contacts. This is all progressive overload. And once we're doing those in a very, safe and controlled environment, we can start initiating it with a sprint beforehand, and then a sprint and adding a flip after it. So it's really, really similar to how you progress something lower body. You just have to take that into consideration and do the same for upper body.
Right. Take the skill and deconstruct it all the way down to the simplest form and then progress it from there. As you were talking about that handstand progression that you just outlined, it made me realize that sounds very calisthenic based, which makes a lot of sense for a sport like gymnastics, where most of the sport is, body weight based. But you mentioned that you also like to load patients. And I know that I feel like every time I open Instagram, I'm seeing one of you, whether that's you or Katie or Ryan, someone's posting some crazy barbell video of them just moving tons of weight. How do you kind of apply like the stereotypical weight room concepts into a sport like gymnastics? What kind of training tools do you go to? How much do you load? Is there such a thing as loading too much or too often? Where does your kind of mind go from like the strength and conditioning side, I guess?
Yeah, so typically when I am programming or rehabbing these athletes back, there is going to be an external load component because, like I mentioned, the forces are just so high that in order for the body to withstand them for a length of time, this is how we condition and prepare the body for that. I'm going to look at movements that mimic the skills. So when we're doing these flips, there's a lot of hip extension. So I'm going to look for movements that require hip extension. So glute bridges are fantastic. They're easy to learn, easy to teach, and easy to load. So that's kind of my go-to, is what I can teach well and load easily. Especially these athletes, they're typically younger. So I don't want to, hand them off with a kettlebell snatch right off the bat or a barbell snatch right off the bat, because for the most part, a majority of these athletes have not had any exposure to the weight room or different lift patterns. So I want to start them off with things that they're going to be able to do and manage on their own. And on top of that, we have to remember that they're mostly children. So you have to get the parents on board as well. And usually if you start teaching them barbell snatch, the moms or dad are going to be like, no, thank you. With or without an explanation, they're going to pull them. And so it's about, that buy-in too, because so much surrounding the gymnastics culture is still the mindset of don't load, don't strength train outside of gymnastics. And so we don't want to feed into that. We want to educate and see that this is a benefit, not something that's harmful. So different patterns for hip extension, because again, in each event, that's a requirement. And then a triple extension. These athletes have to sprint. These athletes have to jump high. So weighted plyometrics. You always want to start low and work the way up. You asked about is there too much to load? Depending on what portion of their season they're in. So that's another really big consideration, is the periodization and programming for the year. So you want to consider that when they're in season, you want to tone down the weight. You want to taper. You want to have good movement patterns with a fairly medium load. If we're talking RPE, maybe 6 to 7. But then when we usually hit summer, that's typically the off season, you can start ramping up, building, teaching new movement patterns and loading a little bit more. And that's a cycle throughout the year, just like with any other sport, football, baseball.
Yeah.
Things like that.
That's a great point. And I feel like a lot of times if I'm treating a gymnast in the clinic, they're already often kind of borderline on that load threshold. Like some of them might already be overloading a little bit. So if I go too far with that, I start adding insult to injury. And it can create a very downward spiral real quick if I'm not careful. So, a lot of times I might get critiqued because I am a very big fan of loading, but that's very common for the patients I work with post ACL. We need to load them heavy. We need to load them often. We can hit quad 6 days a week, and it might still not be enough. With the gymnastics population, it's very, very different. And I also really love your point on the Olympic lifting side. I feel like the longer I've been in this kind of field or realm or world or whatever you want to call it, the more I keep coming back to this really silly quote from Kenny Powers about trying to be the best at what we call real sports and not the best at exercising. Exercise is good and lifting is good, and we should encourage that on as many people as we can. However, there comes to a point where it almost kind of gets to be like not interesting, as you mentioned. People want to be really good at what they're there to do, in this case, gymnastics. And if you start spending so much time teaching them a complex Olympic weightlifting movement that may or may not have the best carryover to their sport, you're not only going to get missed interest, but you're going to spend a lot of time teaching something that, maybe you could have accomplished with something a lot easier. So I love that point on, hey, maybe this would be a great exercise for them, but maybe it's not the thing I'm going to reach for right now.
Yes, exactly. And buy-in and interest is a huge part of the athlete doing well in the clinic. So if they don't like it either, then we have a whole nother kind of issue at hand. Personally, I love to work kettlebells with these athletes because they allow for such a large range of motion and they require a lot of stability, two huge factors in the sport. And there's such a variety of moves and skills and complexes you can do with just a kettlebell that has been something I find these athletes enjoy and benefit really well from, because there's just so much you can do with the kettlebell. So that has been something where I have shifted as well, not solely relying on, we need to overhead press barbell. It's like, no, kettlebells are actually a little bit better because, again, they allow for that good range of motion, stability training, single arm, double arm. So that's kind of what I learned and experienced, and take it and run with it.
Yeah, no, definitely. A while ago, you had brought up the point about, this is a great area for PTs to kind of get immersed in and play around with, for lack of a better way to put it. I think there's a lot to be said about someone who, walks the walk in addition to talking the talk. And I feel like, at least for me, my kind of general rule has been I want to be able to do whatever the athlete in front of me is doing, or at least be able to demonstrate it. And that's an area I've struggled with gymnastics. Like I haven't mastered the handstand walk yet, for example. So what kind of things would you recommend to PTs who want to learn more about this world from a physical training standpoint?
Yeah, it's such a cool world. And I don't think that it's necessary to be able to perform the skills, but understand how they work, how they function. So you said the handstand walk, that's a perfect example. Just because you can't do it doesn't mean that you can't understand what the mechanics are. And there's a lot of courses, there's a lot of Instagram material, so it can be hard to pick and choose at what to learn from. But really, how I mentioned before, breaking it down like you would the lower body. So what do you do before you walk? We think back like acute care when we have those clinicals. What are we doing with these patients before they walk? We're weight shifting. We're working on single leg balance or tandem stance or skills that are going to help walk. And that's what you apply to the upper body. So we're talking handstands. We need to be able to hold first, a static hold. And if we can't do that freestanding, how can we manipulate the skill? We put them against a wall, or we shorten the lever, we bring them into a pike position. But that's the baseline, is being able to do a double hand static hold, just like we would need to in preparation for something with the lower body. Then we can start weight shifting. So I'll introduce shoulder taps, actually a prerequisite for walking. And I say that you'll find people say, oh, I've never practiced them. It's like, yeah, you can get to walking without practicing weight shifting, but in something much harder, like walking on your hands, probably don't really want to miss that step. Or it's just a great conditioning tool to help improve your walking or the time spent on your hands. So everything has sort of that stair step ladder progression, and skipping steps is going to lead to difficulty at the later progressions. So really just coming back down, maybe taking a few steps down and saying, what piece can I enter at that's going to help me get up to the next stair step? Yeah. So for you, in your case, it would be a great little test. If you're not handstand walking yet, spend a few weeks doing shoulder taps. And those are my weight shifts. That's typically what I use in a pike position. Mm-hmm. Once you get good and you feel comfortable, go up to handstand against the wall. Once you feel good with that, go freestanding, and then start building back into walks and see where that progress goes.
I like it. I like that breakdown. I like that progression you just outlined, Hannah. And, I like the handstand. And I've even used that I had a gymnast I rehabbed in the past who had a concussion. And I think that position is great for concussion rehab as well from a neuro standpoint, because the world kind of flips upside down. And the handstand is nice because you really just need space and possibly a wall. You don't need a ton of equipment. But as we were talking earlier, sometimes some of these various gymnastics skills require equipment to perform or master. From a, facility outline standpoint, is there anything in particular you highly recommend to PT clinics who want to, offer a higher level of rehab to a gymnast? I think you might have brought up the flooring before as one thing.
Yeah, so typically progression back into return to sport, one of the measures I'll incorporate is the surface type. And so the spring floor is that hard surface that they have to get back to. But then we're looking at things like a tumble track or a trampoline, which is in the gym. So I consider that a soft surface, very springy, gives a lot of boost, softens a lot of impact. Then we have a medium surface, which is something that's going to be what we call an air track or a rod floor. There's just more bounce and a little more give. And so that I term like a medium surface. And then we have hard surface, which is either basketball flooring for cheerleaders or spring floors for gymnasts. So I'm fortunate enough at Old Bull, we do have an air track, which is going to be something I inflate, and it's a trampoline, but filled with air. So it's like a medium impact, and I'm able to, progress the skills on that medium surface before telling them, okay, yes, go over to the hard surface. So in-house, that is a really, really cool piece of equipment. Doesn't take up too much space because it is inflatable and you can deflate it. Takes like 60 seconds, which is amazing. So that has been really helpful. And anyone who's looking for pieces of equipment that might benefit their athletes, that's a great one. It's also really useful in other sports for the same purpose, softening that surface and allowing for more like plyometric excursion because it's so bouncy. Let's think. Another really, really great tool we have at the gym is the rings. And it sounds crazy because the women don't do rings, but in terms of like returning back some sort of hand, shoulder injury, or even back, that traction, or that single arm support, anything where you're getting exposure to grip strength aside from a static bar, because the ring is so unstable, it's an additional piece to the rehab that we're able to use. And again, it really doesn't take up much space. That's the cool thing about these pieces. And we also have the stall bar, which I'm not sure if you're familiar with, but it's the rungs that kind of look like a big ladder. So again, doesn't really take up much equipment, but so much benefit that you can use and return to sport with these athletes just from, a couple feet on the wall.
Yeah, no, definitely. I love that kind of outline there. And as you mentioned, it doesn't take up a whole lot of space. And a lot of those things are fairly cost effective as well. I know in my home gym, I think I got a set of rings for like $40 or $50.
Yeah.
So it's not like we're breaking the bank to get this here. I've seen clinics spend more money on a new hot pack tank, which if you're that clinic, I'm going to ask why.
I also am going to ask why, but to each their own. Rings 1,000 times over that hot pack machine.
Yes, very much so, very much so. And you've done a lot of impressive stuff yourself in the world of gymnastics and calisthenics, Hannah. Has there been anything that you've done that really stuck with you or impressed you?
Yeah, so I mean, really, my whole career has stemmed from the just love of the sport, which I thank my mom every day now. When you're a kid, you don't realize it. And then you're all of a sudden you're an adult and you're like, wow, thank you for putting me in this 2-day camp that has created my entire life. But over the last, I'd say 4 years, I really started like ring calisthenics and stall bar calisthenics, and being able to progress on both of those has actually helped me as a clinician be better for my patients, because I myself are learning new techniques, new drills to better myself, but also to help better my patients. And so it's kind of a win-win. And it also keeps me moving, which again, practice what we preach. So it's like high up on my list. I want all my patients to know that I also participate in exactly what I'm preaching them to do.
Yeah, I love that. I love that. And, I feel like I have a lot of respect for individuals who, as you mentioned, practice what they preach, who go the extra mile. And, some of the stuff you do is truly remarkable. Like, I don't know if I'm ever going to be able to do some of the things that you do. It's just absolutely crazy to watch.
Let me know when you're coming to Miami. We'll have a whole training day.
I'm down for that. And I think that's one of the beautiful things about a sport like gymnastics is it really is something that, to the average person or to someone who's just washed up meathead like me, it's just amazing to watch. And I think that's really what, gets us interested in the sport. But I feel like you and I could probably talk about gymnastics all day long at this point, Hannah. And we really just scratched the surface today. For people who want to find out more about you or maybe learn more about the sport of gymnastics from a strength and conditioning and rehab standpoint, where can they find you and what kind of resources would you recommend to them?
So you can find me in terms of physical location. I mentioned I'm down in Miami. Old Bull Athletics is the clinic that I am practicing at. Instagram, and I can provide you with that link, but it's going to be H Sadowsky. So Hannah, the letter of my first name and my last name, and Old Bull. You can also follow Old Bull Athletics. You can find me there. You can find me on my personal page where I talk a lot about these different skills and different ways to progress or regress them. So if you're wanting to learn the skill, learn more about rehabbing these athletes, you can also reach out to my email, which is my first and last name, hannahsadowsky@gmail.com. And I am open to all questions. And I hope that I do get some, because I love talking the topic, talking the skills, and getting to know the community.
Yeah, for sure. I mean, when is your gymnastics PT Con Ed course coming out, Hannah?
Actually, stay tuned, 2024. We're going to have some body weight courses coming out. So all the fun skills we've been talking about, if you've been interested in learning them yourself, stay tuned. There's going to be a lot of fun stuff coming in the next year.
That's amazing. Looking forward to that. Hannah, I really appreciate your time and everything you're doing for the, performance PT community and the gymnastics community. Really appreciate you.
Yeah, this was awesome. And I can't wait to talk again on the topic, because like you said, we could go on and on and on.
Thank you so much for listening to this episode of the Brawn Body Health and Fitness Podcast. If you liked this episode, please make sure to share it with a friend, subscribe so you don't miss any of our upcoming episodes, and leave a review. This way we can spread knowledge and motivation and help reach more people. Thank you again for listening, and I'll see you next time.